Good afternoon, everyone. Welcome back to my channel. I am Tammy, and I want to discuss a little bit further today on Medicare and secondary insurances that can go with that Medicare. In the previous video, we talked about Medicare that is primary, insurances that can be primary for elderly patients. Today, I want to talk about insurances that can be secondary to Medicare, okay? So you have your traditional Medicare. That's your Medicare where you have the card and it has Medicare Part A, Medicare Part B, and then you're going to have the dates in which you enrolled into that program. For secondary insurances as it relates to Medicare, 9 times out of 10, you would have to pay out of pocket for those secondary insurances. There are a lot of secondary insurances that are out there. Unfortunately, there is a premium. I don't know, each one has set their own premium, so you would just have to do your own research to see which one is best for you. For patients and elderly individuals that may have Medicare but have Medicaid secondary, there are some requirements that you must meet in order to get Medicaid secondary to Medicare. And that is, you must have a disability, or you have to collect a SSI income. Those are really the two qualifications. And then there's a third qualification that you can apply for if your parents, your mother, father, or family member have to go into a nursing home. You have to pay out of pocket for that nursing home if you are going for long-term care. If you are going to that nursing home for a skill visit for rehab, if you have a peg tube, Medicare will pay for that, and you don't have to have a secondary. But for those individuals that need a secondary insurance or wants the secondary insurance just to have it, there are eligibility requirements in order for you to get that if you want to do the Medicaid. Like I said, there's also, going back to my first point, if you want to pay out of pocket for a Medicare supplement, you can do that also. Thirdly, you can also have a secondary insurance if you retired from a company. Let's say that company is paying your pension, and when you retired, they told you that you would get their insurance for the continuation of your life. Then that is another secondary insurance that can be used with your traditional Medicare. Now, as stated in my previous video, if you have a Medicare HMO, some of those Medicare HMOs, especially in the state that I am in, you can have a dual complete, which is Medicare and Medicaid combined. But a lot of those Medicare HMOs, or it may be described as a Medicare Advantage Plan, there is no secondary insurance. That Medicare HMO and Medicare Advantage Plan is your primary insurance, okay? Those, you just have to sit down with your families and see which one is best for them. My best advice for you would be to Google them, maybe go on to secondary insurances to Medicare for seniors and see what type of list you can come up with, and then that can be your best direction. And then also, like I said, you do have to pay a monthly premium. Now, I don't know how much that will cover. I don't know if it will cover, most secondary insurances will cover outpatient. It'll cover your labs. It will cover your hospital visits. And what you normally do is when you check into your doctor's office, your PCP's office, you would give them your primary card, which is that Medicare traditional Medicare card, and you can give them their secondary insurance. You research. That's all we can do is just research and see which one is best for our parents, because we want to help our parents and our loved ones as much as we can to make this process best for them. They may say, well, the traditional Medicare is not good, doesn't work for me. I think the Medicare Advantage Plan is better. But just remember, with the Advantage Plan, it works like a commercial insurance, okay? And then you're going to have co-pays that you're going to have to pay whenever you go to see your doctor, whenever you go to the hospital. Most of those not secondary plans, but most of those Medicare Advantage plans, there is a supplement Part D for your drugs that may be attached to that. And then also, that's another piece of the puzzle that you may want to sit down with your families and figure out to see if they do qualify for that Medicare Part D. I hope this answers some of the questions that you may have. Like I said, I'm just here to try to help my Gen Xers such as myself, help those baby boomers out there, try to help them navigate this entire healthcare system. Everything that I say in this video is my opinion based on my years working in healthcare, and we just want to try to make it simple for our loved ones. If you have any questions, please comment below. I will get to it. And like stated before, if I don't know the answer, I don't have a problem telling you that I don't know the answer, okay? Please like and subscribe, and I will see you next time, and we'll talk about something new, something else that will help benefit our elders. All right? Talk to you soon.